Assalamu alaikum and a very warm welcome to Natural Health on Deen TV with me, Dr. Fatima Paruk. Join us here each week on Natural Health so that we're able to familiarize you, our viewer, with the expanding world of alternative and preventative health by introducing you to diversity of different therapies and practitioners, as well as health-related topics from a natural health point of view. I look forward to bringing you up-to-date and interesting health-related shows that enable you to make informed choices about your health and keeping you abreast of the many natural health therapies that are currently available here in South Africa, their individual benefits, and how they can be used effectively for specific health-related issues. Joining us today in studio, we are very fortunate to have Nasreen Manju. Nasreen qualified as a physiotherapist in 2003 from the UKZN University and went into public service at Wentworth Hospital before stepping into private practice at St. Augustine's Hospital, where she worked very closely with pediatrician Dr. Das Pillay, who had a very large ADHD client base. It's at this stage that she began research and development into specialized programs in treating ADHD. In keeping with current trends and research, she found her way to the field of neurofeedback, which is what we are going to talk about here today. Thank you, Nasreen, for joining us here today on Natural Health.
Hi, Assalamu alaikum. Thank you for having me here today with you.
Nasreen, neurofeedback's always been something that's interested me a lot, and there's lots of evidence that supports this therapy. Can you tell us exactly what neurofeedback is?
Neurofeedback is an exciting development in neurological training of the brain. It is an exciting concept, especially here in South Africa, because it's relatively new here in South Africa as compared to the rest of the world. Basically, it allows us to evaluate brainwave activity, which is quite intriguing, because basically what you can do is attach sensors onto a scalp and read brainwave activity. So basically, when there is a chance that a person might have faulty brainwave activity, for example, it might manifest as ADHD or learning disabilities, we can now have insight into how the brain is behaving and the activity of the brain by placing sensors which read these brain waves. So what we can actually do is we can track brainwave patterns within the brain and then go on to treat it and train the brain to be able to behave in the way that we would like, or the ideal way for optimal function.
Okay, that's really, really interesting. Can you tell me, how long does it take before one would get results in this kind of treatment?
Okay, so basically, if I can explain it by way of neuroplasticity, I know it's a little bit of a scientific concept, but it's quite intriguing. What basically the brain can do is it can relearn. So if you have a problem with the brain, for example, a person that has a stroke, a certain part of their brain actually dies because there's a lack of blood flow to a certain area. But it has been discovered that the brain can actually relearn new tasks and techniques. So basically, another part of the brain that was not involved in control of the right side of the body, for example, can now be trained to be able to actually perform that similar function. So the brain can grow and adapt, which is very interesting, and that is the concept that of neuroplasticity, and it's the concept that neurofeedback actually follows. So every day we are learning. As we are developing, we are learning new ways of interacting with our environment, and it is discovered that you can actually teach the brain certain skills by enhancing those brain waves that are not acting in the way that we want to. For example, I'll give you a small example. If on assessment, when we attach these sensors onto the scalp, if we find in certain areas that there is a dominance of alpha brain activity, which basically is your relaxation brain waves. What happens is, if those brain waves are more prevalent in areas that control alertness and peak performance, what happens is, or cognitive development, for example, if it's in the frontal lobe of the brain instead of in the back of the brain, what happens is that person then becomes very relaxed in situations that he's not supposed to be relaxed in. And what we can do is enhance that brainwave activity that's supposed to be there to allow the person to become more developed in the situation that they're supposed. So we can teach them to concentrate for a longer period of time, or to get into what we call a peak performance state, where they are able to hold concentration for a longer period rather than stay relaxed, if you know what I mean.
So essentially, and correct me if I'm wrong, what you're trying to do here is almost reprogram the brain to find new pathways that it can use to adapt or compensate for areas where it's lacking or there's a deficit of some sort.
Yes, something like that. Obviously, it's quite scientific and it's quite in depth, but if you simplify it, basically every day we are relearning in new situations. I'll take a small example. When you're riding a bike, when you're learning how to ride a bike, the brain is actually being stimulated, and you are learning a task. So there is brain involvement in learning that task, and there are neural pathways which are being laid down in order for you to learn how to ride a bike. So once you learn how to ride a bike, you then know how to do it forever. You will not forget. So similarly, when you develop the brain and train it to learn a task, for example, to concentrate for a longer period of time, that task stays with you, and that learnt behavior stays with you for the rest of your life. So children, for example, that have ADHD or difficulty with concentration, or are not mature in their development of the brain, they will lack on the skill of concentration, and they will not have those neural pathways developed sufficiently enough to be able to handle sitting in a classroom situation. So neurofeedback then allows them to look at their brain, because at their brainwave activity, because basically it shows up on a screen, and then the therapist, if they are skilled enough, they can teach them how to extend that period of concentration by getting feedback and brain signals. So basically it's just a way in which to train the brain to be able to concentrate for longer.
Two things I'd like to pick up on. It's very individualized. It sounds like it can be very individualized per patient and per treatment that's needed. So you can probably adjust your therapy for a specific person and according to their needs. Am I right in saying that?
Yes, definitely. It is highly individualized, because each one of us is born with a brainwave pattern. We each have our own individual brainwave pattern. So similarly, as we would have strengths and weaknesses with muscular development, in the same way we have strengths and weaknesses within the brain. For example, some of us are not able to concentrate for a long period of time. Some of us find it difficult to get into a concentration situation. For example, if you're studying, you might find that your brain wanders, or if you have busy brain. Some of us have difficulty to be able to perform when we need to. So neurofeedback just helps enhance that and teaches you to be able to switch your brain on when you need it to be switched on. So if you need to study, if you need to concentrate in the classroom, if you need to do anything, you are able to have control of your responses to the environment and the stimulus in the environment. So you are then able to say, okay, now I have control over my brain. I know what happens. I know that I cannot concentrate easily, but with neurofeedback and within those training sessions, you learn how to do that, and you can have control of your response to the environment.
Can you tell me what a training session entails? I know you said we've got to create these new neurological pathways. We've got to reteach different parts of the brain to perform other activities in order to compensate for areas of loss. But what stimulus do you use to actually teach this to a patient?
Okay, so basically it's a non-invasive technique. It's a little piece of equipment that gets attached to a computer, and this little piece of equipment has sensors on it, EEG sensors. So we place the person in front of a computer screen. We then locate the sites of the brain that we want to test on the scalp. We scrub the area with a little bit of a conductive paste, and then we attach those sensors onto the front, middle, back, depending on how many sites we want to test. Then that brainwave activity translates as an image onto a computer screen. So basically, it's a mini EEG reading. You're getting an EEG brainwave pattern showing up on the screen. Now, the therapist then has to be skilled enough to be able to assess the data. So we give the child or the person that we're testing different tasks. We take a reading of that brainwave pattern when the person is just looking at the screen. We take a reading when their eyes are closed, and we take a reading during a cognitive task, like a small mathematical task. And then we want to see the adaptation of the brain during those tasks. So for example, we want to see when the person is performing the mathematical task that they become automatically alert, that we're picking up more thinking brainwaves instead of relaxation brainwaves. We analyze that pattern that we see on the screen. So that assessment process takes a little bit of time. That is quite a long process, and that's where the skill of the therapist comes in, because collecting the data and collecting the readings is a simple process. The complicated process is then doing a mini QEEG, where you look at those brainwave patterns and you pick up where the fault actually lies. So is this child losing concentration instead of becoming alert while you're giving them a thinking task? Is the person becoming more relaxed instead of waking up? Is the person the opposite happening? Are they becoming more anxious when their eyes are closed instead of relaxing? If they're becoming more anxious and you're seeing more thinking brainwaves and more concentration brainwaves, then you know, okay, this person might have problems with anxiety. The skill of the therapist comes in assessing the data that they receive from the brain. So that is the assessment part of the process. We then go on, once we find and analyze this brainwave pattern and we pick up where the faults lie, we then go on to develop a training program to be able to inhibit those brainwaves that are not needed and to enhance the others that are basically needed. So how we do that is during the training process, the area of the brain that we want to train, we attach the sensor onto that area. You then see a pattern on the screen. The person looks at that pattern, and then they are given certain cues. So for example, a music might come on in the background, and the computer will give them active rewards for relaxing while that music is coming on, if you're treating relaxation or wanting to enhance relaxation brainwaves. So the cue from the equipment basically stimulates the brain and trains it to what brainwave pattern you want to enhance and what you want to inhibit.
That's really interesting, that the computer does a lot of the work for you. But is it very patient dependent then? Does the patient that's receiving this treatment really have to be concentrating on what's going on, have an active role in the therapy itself? For little kids, are they always interested? Are they able to follow the cues?
That's where, again, the skill of the therapist comes in then, because obviously if a child is underage, if they're under 6 years old and they're unable to sit for a long period of time, or they get edgy, we then have to involve them in certain tasks. So for example, example, we'll give them a coloring activity. So even while they are doing something, they're still getting a cue from the computer. They're still hearing the response, the ping, the response from the computer. So they are actively involved in their therapy session, even though they might be performing a different task. And part of the therapy we actually use with them performing a task, so that they know how that mimics the classroom situation. When they're in a classroom and the teacher is speaking, they often have to perform a task while the teacher and listen to the teacher at the same time. So in the same way, they're performing a task and they're hearing the response of what their brain performance is during that session. So if they are concentrating and they get into what we call a peak performance state, then the computer will give them a positive response by way of an auditory response. So basically there'll be a ping, there'll be a response from the computer, and then the brain automatically learns the process of concentration and being able to concentrate for longer.
So it is quite interactive per se.
Yes.
The patient is involved in the process of learning, involved in the process of therapy.
Yes.
At every stage.
It is.
You talked a lot about ADHD and treating children, and I know it's part of the reason that you got into neurofeedback to start with.
Yeah.
What's your success rate, you would say, in treating ADHD, concentration difficulties, in kids, let's say up until the age of 13 or 14?
We've had excellent results with children and improving concentration. I've worked with hundreds of kids. The ones that we've had the best results with are the ones where the parents are most compliant. So this is not, neurofeedback itself will not help the child. You've got to have a medical team together. I've worked directly with pediatricians and doctors who have been treating patients with ADHD, and compliance in terms of nutrition and diet, medical compliance, how they take their medication, because a lot of these patients were already on ADHD medication, and also the compliance with how often they come in for their neurofeedback sessions. All that together gives you the response that you require and the results that you require. So the best results have been where parents have been compliant with bringing in their kids, and whereby they have completed their program. So it does take a while for the brain to actually learn, because it is a learning process and a learning curve and a developmental process. It takes a few sessions, like sometimes 25 to 30 sessions, before you actually the results are noticeable. So those patients that have completed their sessions, we've had amazing results with, and we've seen that with their academic performance. We've had patients that have had D's and E's coming in and becoming A and B students. Now, obviously, again, it's individual, but they have been very good results.
So what you're saying is, apart from the therapy, there are lots of other variables that need to fall into place to support the neurofeedback as a form of treatment. So you would need your pediatrician to stand in and help out where therapy is needed. You'd need the support. When you spoke about support from family members and parents, and they needed to be compliant, what exactly did you mean? What would a parent's role be if they're coming in to treat their child with ADHD? What did they need to expect to do themselves to support this child during that duration of that treatment?
Okay, so firstly, I'll give you an example. We had one little boy coming in for therapy, and obviously the parent was not too educated about nutrition and diet, and they would give the child a can of Coke, and then the child would come in for therapy. Now already we're not going to get any sort of response from that child because of the sugar rush that, obviously this child was ADHD, so this child was all over the place, climbing the walls, and no matter what I would do, I could not get him to sit still and look at the screen. So parents have to be educated about nutrition and diet and what to feed their children before they actually come in to their sessions.
Okay, a few things you had mentioned I'd like to clarify. I know you said it depends on whether a patient finishes their course of treatment. Just very quickly, how long is a session, and how many courses of treatment does one need in general?
Okay, so basically every person adapts in their own way and reacts in their own way to treatment. So it usually takes 25 to 30 sessions before you get a positive response. But that does not mean, it's like climbing stairs. So all along there would be changes occurring in the brain, but you might not notice them straight away. So they become noticeable after 25 to 30 sessions, and then once those neural pathways are laid down, they are permanently laid down. So that a skill is a developed skill, and that child has learnt how to interact with the environment and has developed those brain waves sufficiently, so they then are able to go into a classroom situation, and they are able to perform better, they're able to concentrate better. They might just slip along the way, so 2 or 3 months later they might still have problems of concentration, then they might need a few brush up sessions, but the skill, the memory of the learnt behavior will still be there.
Okay, and how much in general does a session cost? Is it covered by medical aid?
Okay, so neurofeedback itself is not covered by medical aid. Usually the sessions are about 450 Rand a session, and that's for between 30 and 45 minutes. However, if you go to a psychologist or a physiotherapist or a medical practitioner that is trained with neurofeedback or to perform neurofeedback, they can claim as a rehabilitation session under their time that they work with the patient.
Another quick question, from what age can parents bring their kids in for ADHD, and what's the scope or range of therapy in terms of age groups? I mean, we're going to talk just now about other conditions for elderly patients as well.
Okay, so basically the child needs to be able to sit. So usually about 5 or 6 years old, that's the time, and we cannot start off with a very long session with those kids. We start off with a shorter session, and we might need to break it up, but usually about 6 years old is when I start them with therapy. And that can go on up until, yes, as long as needed.
Okay, a few other conditions I just want to run through quickly, and just tell me yes or no, does it help? What about conditions like Alzheimer's? I mean, it's a cognitive brain disorder. Is there hope in using neurofeedback to treat a condition like this?
Okay, now mainly the research into brain training is with children with ADHD, with depression. There's still research being performed on Alzheimer's and dementia. It's a little bit of a difficult one, but because it is a brain training technique, there isn't a proper scientific study which shows the development of the brain during Alzheimer's using neurofeedback. So the more of the research is into depression and ADHD.
And in your experience for depression, do you have very good results, and does it take as long to treat depression?
Depression, we've had excellent results, especially adult depression, because there are certain programs on the neurofeedback equipment that help with relaxation. So we enhance relaxation brain waves in the areas of the brain where it's needed, and usually within about 10 sessions we find very good results it's a shorter scope, yes.
What about simple things like memory loss? I know a lot of people these days complain about memory loss.
Memory loss, there is definitely improvement with short-term memory loss, and that's also another sphere and field of interest with neurofeedback. So there has been improvement with memory loss.
Nasreen, thank you so much for coming in today. It was really interesting to discuss neurofeedback with you, and I'm hoping to have you back because I hear you're somewhat of an entrepreneur in your field, and you've started a whole new segment with Fit Deli, which is nutritious food that you're providing. People can order. Just very quickly, what inspired that?
Okay, so Fit Deli is quite an exciting concept. How it started was basically over the years, my husband is into competitive bodybuilding and he is a professional athlete. So what I've been doing over the years is we have been experimenting with ways in which to prepare healthy food but still maintaining the taste of the food. So we teamed up with a restaurant owner and entrepreneur, and we developed the Fit Deli, which is basically a meal prep company. So we prepare meals in a healthy way, and we formulate diet plans and packages to assist people with whatever goals they have in mind. So if they want to follow a weight loss program, then we prepare the meals and send them weekly to the client, and we send it all over the country. So basically that's what Fit Deli is about.
I'm hoping to have you back where we can talk a little more about Fit Deli and its success, and also about the upcoming Elite Human Performance Gym that's opening soon.
Yes.
So inshallah, we'll see you here again. Thank you so much for your time and for enlightening me about it.
It's a pleasure.
I've always wanted to know a little more about it, and I'm sure viewers as well have enjoyed your input.
Thank you for having me, Fatima.
You can follow Nasreen on Instagram at Elite Medical. That's it from us here today on Natural Health. Please remember to get your natural health questions answered by sending an email to the address that appears on your screen. We do look forward to hearing from you. See you next week for more on Natural Health with me, Dr. Fatima Paruk. Until then, stay well.